Well, the Antibiotic Guardian idea is really an idea to take awareness amongst the general public about antimicrobial resistance and use to actual action, so that it's a behavioural approach to modifying antibiotic use and developing much more appropriate antibiotic use. So what we're aiming for is for the general public and health professionals and organisations, in fact everybody, including you, to make a pledge to be an antibiotic guardian.
The issue about antibiotic resistance, I think it's surprising for a lot of people to learn that over 80% of the world's antibiotics are fed to animals. And as our demand for ever cheaper and more plentiful meat increases globally, so the proportion of antibiotics that are manufactured being fed to animals will increase. And so we have massive concerns about what that means in terms of antibiotic resistance, rise of the superbug. But in effect, it seems as though we're squandering one of the most precious innovations that we've had in the last 40 years. I think the interesting thing for me within all of this, the power of change is with us, the consumers. It's not, to my mind, it's not necessarily about government, about legislation, because if we start to change our habits and eat less meat, so the market will respond accordingly. So what we prefer is a call that suggests that maybe we should eat better quality meat if we're eating meat, eat it less often and sometimes none at all. And I think that's a much more realistic ambition and actually would have massive impacts on some of these environmental issues.
Our organisation and our audit systems help organisations implement antimicrobial stewardship programmes. We do this by providing an audit system that helps you measure current practice and monitor best practice standards and compliance over time, so you can look at improvements in quality and standards. Organisations require access to best practice standards and guidelines, and our system provides those standards and guidelines on our audit system as staff audit. Our auditing system helps organisations implement antimicrobial stewardship programmes by providing an audit system that will help you measure current practice and monitor practice over time. The system also provides you with immediate access to data. Our system provides timely, detailed data analysis so that you can train staff, improve prescribing practice, monitor practice over time, and then of course you can also measure and monitor the care that you provide so that your patients receive improved care and so that your prescribing practice is improved.
Alira are a world leader in rapid diagnostics, so we develop anything from rapid molecular influenza tests to big pathology analyzer tests, but really we're kind of focusing on bringing testing closer to a patient, and the idea is to improve clinical outcomes for patients, improve healthcare professionals' experience and reduce healthcare costs as well. Alira are very involved in antibiotic stewardship. We actually have a programme called Test Target Treat, which is all about providing, again, rapid diagnostics to enable clinicians to make decisions sooner, and really around prescribing to be able to have accurate prescribing information, really. So by giving rapid results, they can target antibiotics better, and particularly around, we're talking today about point of care CRP testing, which was introduced in the NICE guidance in December last year for patients with suspected pneumonia. And what that result gives them as a clinician is within 4 minutes a GP or practice nurse or healthcare professional can help decide if a patient needs antibiotics. And the guidance is very clear around NICE to help with that. We can provide an Alira Finian CRP instrument that can do that within 4 minutes.
Today's been really superb. I've really enjoyed it. There's been a real wide range of talks about antibiotic use and resistance.